Thank you for listening to Depictions Media Radio. Welcome to Policy and Rights, the show about government policy and human rights. Welcome back to Depictions Media Radio. I'm your host, Michael Clogs. In this next segment, in British Columbia, we're going to be joining Adrian Dix, Minister of Health, Dr. Martin Lavoie. He is the acting public provincial health officer, and Dr. Penny Badlam, executive lead of the BC's COVID-19 immunization plan. And they're going to give us an update on the fall vaccinations, and they're also going to give us a brief explanation on the importance of the fall vaccination and a brief explanation about who should be getting a vaccine this fall, or had this vaccine this fall, according to, of course, your health conditions, immunization compromised, or other conditions that might put you in a category that you are actually going to be needing the vaccine before fall actually comes. They're basing a lot of their advice on, of course, the NACI, the national group who studies immunizations, and they will also give a brief explanation exactly who NACI is and what their job is. So why don't we listen to what Adrian Dix and the two doctors have to say about the vaccination program and who should actually be going to get the vaccine this fall or this spring.
Executive lead of BC's immunization program. Dr. Badlam is, of course, an outstanding health professional and leader, and has done, I think, an extraordinary job in leading our immunization campaign and our immunization program in BC, one of the most successful immunization programs in the world. As part of today's briefing, we'll be providing an update on the next phase of our immunization plan as we prepare for the fall. People in BC have demonstrated a true commitment to protecting themselves, their loved ones, and community throughout the pandemic by observing public health measures and getting vaccinated in record numbers. It's important to recall that 94% of British Columbians, 94%, have received their first dose immunization from COVID-19. And every time, I want to acknowledge and thank every British Columbian who, when they've been invited to get vaccinated, have got vaccinated and protected themselves and their community. These efforts have saved lives. Not a few lives, not 10 lives, but thousands of lives. And of course, around the world, vaccination has saved many, many more than that. Our number one priority is, was, and will be protecting people, especially those at the highest risk of severe illness or death. That is why BC has followed advice from public health since day one and has implemented measures to protect those living in long-term care, elderly populations, and those who are clinically extremely vulnerable, ensured that these groups of people were and are prioritized for vaccination. Equally as important is protecting our healthcare system capacity. This means ensuring our healthcare workers receive priority access to vaccines to protect themselves and those they provide care for, and reducing pressure on our healthcare system through a robust vaccination program and appropriate public health measures based on the best available evidence. I am proud that in British Columbia, unlike anywhere else in North America, 100% of our healthcare system workers are vaccinated with a primary series of COVID-19 vaccines. We also want to keep our communities safe and bring people back together safely. Thanks to people getting vaccinated in record numbers, we were able to lift social restrictions earlier this year. We continue our work to reduce the impact of this pandemic, protecting our health and our health system. Now is the time to continue this momentum and prepare for the fall. These are and will continue to be, as we continue to live in this pandemic, challenging times, challenging for our healthcare system and challenging for people around BC. We've gone through multiple phases and together implemented different strategies to address COVID-19 while protecting critical social interactions. It's why in BC, and we can be proud of this, all of us can be proud of this, we kept schools open when others closed them, because the health and social implications for children were so important. And we're going to continue, as we deal with the present circumstances of COVID-19, to do the same thing. And with that, it's my honor to invite Dr. Martin Lavoie to provide further details on vaccinations to date and the science guiding our decisions.
Thank you, Minister. Good afternoon. So my name is Dr. Martin Lavoie. I'm the Acting Provincial Health Officer in BC. I would also like to acknowledge that we're gathered here today on the land, the traditional territories of the Musqueam, Squamish, and the Tsleil-Waututh First Nations people. So I'll repeat that our first priority is and continues to be to protect people, and especially those at highest risk of severe illness and death. And as the Minister mentioned, we want to protect the healthcare system, its capacity, and protect everybody in our communities as well. But we also want to bring people back together safely. So, since the beginning of this pandemic, public health, we've been keeping our eyes on a number of key factors. And these factors were actually helping us, guiding us in terms of all the recommendations that were made, and also to guide our actions, all the actions that we took to actually manage this pandemic. So these various factors include, among many, a number of things. So initially, if you remember, we were looking at the interval between the first two doses. We also continue to be looking at those new variants of concerns that keep popping up and their transmissibility, how infectious they are. We also look at all the different types of vaccines that we have available for COVID-19. We look at outbreaks. We look at cases, infections, breakthrough infections. We also look, obviously, at what happens in the rest of this country, but also around the world. It's a global pandemic. We look at case rates, the number of cases, how that evolves, and we also look at what happens with hospitalizations. So this work has and continues to be very important, and we will continue to keep our eyes on all these things, and we will continue to adapt as the pandemic is evolving. So as you can see partly here on this graph, the number of deaths and the number of hospitalizations have decreased significantly a number of times, and even more recently. And so we can see that here. And they have dropped significantly from those peaks that we see to much lower levels. Vaccination has made a huge difference to be able to get us there and drop the number of cases, hospitalizations, and deaths. So we need to continue on that trend. We're in a much better position now, And it means that we need to be all up to date with all the doses that are recommended in our particular situations. Unfortunately, we know that there's also about 1.3 million people who have not yet received their booster dose. So being fully immunized with all the doses that are recommended is very important, because we know that it makes a huge difference, provides excellent protection, and it makes a big difference in terms of what we see month over month. So over the last few weeks, as you may have heard, we have seen an increase in the number of cases being hospitalized. So we are keeping our eyes on that. The virus continues to circulate, so we want to be clear, the pandemic is not over, unfortunately, and we are seeing the number of cases and number of people ending up in hospital go up and down, and we will continue to see that. And that is expected. We saw, and this graph here is actually showing, so what we saw in the last 6 months or so is Omicron. Omicron slowly going through and spreading in our communities. In the winter, it was Omicron, one of the siblings, if you will, Omicron BA1, and it came in, and over time, after a few months, it started to be replaced with another sibling, another Omicron BA2, and BA2 took over, BA1 disappeared pretty much, not completely, and that's what we saw in the spring, so just a few weeks ago. And this is what Omicron is doing. Again, it looks like we're seeing an increase in BA5, as you probably heard, and we are seeing that. So, same pattern for Omicron, as one of the siblings, if you will, of Omicron is taking over. And we are going and continue to go through a similar process. We are in a good place. We did quite well. Not perfectly, but we did very well, actually, during the first 2 waves of Omicron. And this is what we are seeing now. So we're keeping our eyes on that. We expect BA5 will probably become the majority of those viruses that we're seeing. So when we look at the number of cases of serious disease, particularly hospitalizations, so we see that the most at risk, those at highest risk actually of getting severe disease, is by far those who are 80 years of age and older. We see also, but much lower risk, but still elevated risk, but much behind the 80 years and over, the group that is 70 to 79. So these age groups are those driving what we see in hospitals. So these are the ones most at risk of severe disease and most at risk of being hospitalized. So what I said in the data that we're showing, it shows how important it is to be vaccinated. And so for this particular group of people, those at highest risk or at higher risk, we are recommending, as you know, a second booster, a spring booster. And that is to help them maintain a high level of protection that they are not able to maintain otherwise with just one booster. So this is a particular group for which we have recommended a second booster. And actually a lot of people have taken advantage of that, but not everyone. So now looking forward, so in the fall and in the winter particularly, this is when we know respiratory viruses, COVID-19, are expected to circulate in much higher numbers. And this is when many people get sick, and this is when the risk of getting infected increases. So that's why right now it's very important to have received all the doses that are recommended, and also to take measures to stay safe and to protect people around you as well. So right now our layers of protection are similar, slightly different. We're in a better place. We were able to lift the restrictions we had put in place before, which is good. We're coming back together safely. But we need to continue. And so I want to emphasize, and this is very important, that individually, we all continue to play a role. You know, I see people here wearing masks, keeping your distances when you're in crowds, not going out when you're sick. These kinds of things are extremely important. Washing your hands as well, very important. And so these things are measures, actions that people can take, continue to take, and people do, and we encourage that. We should continue to respect everyone's personal space. Some people have various medical conditions that put them at higher risk. It's important to respect that. Consider their particular situation before interacting with them. And I mentioned clean your hands and staying home when you're sick. That is very important. When you know you're sick, you don't want to bring the virus to others. Most importantly, of course, and it's critical, is to get vaccinated. And we have made many recommendations for the primary series, the booster, for some people a second booster, and now we're going to be talking about the fall booster. Vaccines and vaccination offer excellent protection against severe disease, and that's the path we're on, and we continue. We're taking the next step in the fall. So the National Advisory Committee on Immunization, NACI, is very strongly recommending that vulnerable people, so those 65 years and over, and people with medical conditions, receive a fall booster. NACI also recommends that all others between 12 and 64 receive a fall booster as well. So NACI is a group of experts from various backgrounds and expertise, working together, keeping a very close eye on the situation, on this pandemic, the epidemiology of the pandemic, on the vaccines that are available, keeping an eye on research, and on an ongoing basis, keeping track of all that to make sure that they can make the best recommendations to guide us, particularly with the vaccines, on how to manage this pandemic in the best way possible. So we have in BC followed very closely NACI's advice, and we continue to do so. And so this is no different at this time, and this is what their latest recommendations are about for the fall booster. So I want to talk a little bit more about also new vaccines that are more than likely coming to us. I think this is very important to know at this time, understanding what's coming for us in the fall. So after over a year and a half, maybe a little bit more than that even, we have now direct experience with COVID-19 vaccines around the world. So we've learned a lot. And so now we have a much deeper understanding also on how to make those vaccines to protect us against current strains, current viruses that are circulating. So what's important to know now is that the manufacturers have developed vaccines that will be better adapted to Omicron, which is great news. And this is what we're going to see more than likely. Things seem to go very well right now in terms of their assessment. They seem to be very promising. And the virus has evolved, as you know, over time. We have the original virus that started a while ago now, and then we had the alpha, the beta, the delta, and many others. And it has evolved, and our vaccines need to evolve as well, so that as the virus goes further out, away from the vaccine that we have now, we need to have a vaccine that actually is closer related to what circulates to be more effective. So these bivalent vaccines, and bivalent means two, it's going to contain the same as the ones we have now, the original virus, and the Omicron as well. It'll be able to be effective against those two strains. And they look very promising, like I said, but they still need approval by Health Canada. And so this is underway right now. So we have to wait for that. Like I said, it looks promising, but it's not done until we have confirmation. And NACI is also at the same time reviewing, and they will be making more specific recommendation, as they said in their latest statement, about the types of vaccines that would include the bivalent vaccines. The two brands that we are expecting for those vaccines are Pfizer and Moderna, brands that people know very well. So they're going to be mRNA vaccines as well. So we know that COVID-19 vaccinations are very highly effective, and booster doses are extremely important. We have recommended boosters now for quite a while. It helps bring your capacity to fight the virus back up again, but also extend so that it lasts longer. And so with boosters now we can actually be assured that we are very well protected for much longer period of time. And so the boosters have actually helped us transition away from the crisis phase where we were a year and a half ago, and then we started using those vaccines and things were happening very fast, to a more stable, more long-term management of this pandemic. So those new vaccines and the boosters will be critical to help us maintain our trajectory, very positive trajectory so far in terms of managing this pandemic. Thank you. So now I would like to pass it on to Dr. Penny Ballum. She's the executive lead of the immunization program, and she will talk about how to operationalize all these approaches that I've just mentioned. Penny?
Thank you so much, Dr. Lavoie and Minister Dix, and welcome to everyone. It's a privilege to be here and just to talk to you about the new, evolving phases of our vaccine program. I thought what I would do first of all is just give you an update of where we are with results of our overall vaccine program. I think you know that we have, for our primary series, got really extraordinary results in our province, with 93.8% of our eligible public, 12 and older, having received their first dose. And 91.2% have received their second dose of vaccine. So this means that 91.2% of those who are eligible are actually fully vaccinated. And this is something, as Dr. Lavoie has referenced, is really a remarkable level of protection when we look at jurisdictions across the world. We started our first booster program, you'll remember, back in October. We started out with the most vulnerable first, and if you look at all the people eligible for vaccination, 59.5% of those have received their first booster. And if you look at the people that actually were fully vaccinated, it's actually, of all those, because you can't get a booster until you've had dose 2, it's up to about 66%. So 66% of the people that got their primary series have actually taken the opportunity of their first booster back through November, December, January, February, and they're still coming. But I just want to draw your attention. There's still 1.3 million people who haven't yet had that preliminary booster. That's very, very important, because that means that if they've only had dose 1 and dose 2, yes, they've got a good level of protection, but they're starting to get too far away from those doses, and they need to get that first booster. And we're ready for them at any time. And I just want to mention that some of them have wanted to try some of the newer vaccines, the Novavax. Some are interested in Medicago, and we are working hard to make those vaccines available. Novavax has been in the province now for a couple of months, and we are matching people up with our pharmacists around the province. If they want Novavax as their booster dose, we're trying to enable people to get what they want in order to get them that booster. So to the 1.3 million out there today, if you haven't had that first booster that we started back last fall, please go and get it from your local pharmacy or from one of your health authority clinics. And as Dr. Lavoie mentioned, we started what was called the Spring Booster Program that was, as NACI advised us, focused on more vulnerable groups and people over the age of 70. And at this point, of the people that were eligible for that, 64% have taken it up. And that's a reflection of, we know the older people and the people with conditions that immunosuppress them, they're keen. They really know they need protection. We know that the risk of COVID and poor outcomes is related to age primarily, and other conditions where your immune system is not active. So it's not surprising that we've had that level of uptake so soon. But again, there are still over 200,000 people who have received an invitation for this spring booster who haven't yet taken up that opportunity. And we really encourage those people because they're the group that our advisors, our scientific advisors at the national level, NACI, has said, you need this protection. Before I go on to the next slide, I really just want to do a shout out for the pharmacy sector in the province and the health authorities who have worked together to support this campaign for the spring booster, and we'll be working together as we move into the fall booster. They've done a remarkable job. We have anywhere between 600 and 700 pharmacies every day offering vaccines everywhere in this province. And then for the health authorities, they are covering off the small children where people are able to pharmacy to some of our more rural and isolated areas, working with the First Nations Health Authority to make sure our Indigenous communities are having access to the full range of immunization. So a big thank you to them. It's been they've been at that for a long time, and it's really great to see the results. So just a little bit more detail on the second booster campaign, our spring booster. As you remember, that were and this is just some data to show you that across those they're having good uptake, and I think we're very happy on the long-term care and assisted living residents that they were vigorously taking up on this booster, and that's made a big difference in that sector for just the number of cases of Omicron that we've seen. So as you can see, as our vaccine campaign has evolved, it gets more and more complicated. And, by age, by vaccine, we now have gone from, originally 2 vaccines that we were working with for the first year of the campaign. We now have 7 vaccines. We've got Moderna, Pfizer, we've got pediatric Pfizer, we've got Janssen, we've got Novavax, and we had AstraZeneca and Covishield. So this campaign has become more complex, and as the different age groups, we've had different vaccines developed for them. So if you look at people 12 and over in our province, they've been eligible for dose 1, dose 2. If they were clinically extremely vulnerable and immunosuppressed, the CEV 1 and 2 groups, they were eligible for a 3rd dose to get them fully vaccinated in their primary series. And then we have the 2 booster campaigns. The first booster campaign that covered everyone except for the 5 to 11-year-olds, and the spring booster number 2, that actually covered the vulnerable groups we've just talked about. For children 5 to 11, remember we started our campaign in very beginning of November. There was a lot of excitement that those children were going to have access. So again, they are now eligible for dose 1, dose 2, and for those younger children who also have compromising medical conditions that immunosuppress them, children with cancer, children with different kinds of autoimmune disease and immunodeficiency, they were eligible again for a 3rd dose to complete their primary series. And now Health Canada and subsequently NACI will be looking at whether we advise that these children 5 to 11 will receive a booster dose. So that is still under consideration. At this point, children 5 to 11 are not eligible for any booster dose. And I think we're anticipating approval of a vaccine, a special formulation of a vaccine for children, the really small ones, 6 months to 4 years. And so that will essentially mean from 6 months on up, everybody in this province will be eligible for at least a primary series. So we're hoping that by the end of July, we will have the approval by Health Canada and NACI to commence that campaign. The health authorities will be delivering that campaign. For small children, they'll be merging it with their 5 to 11 clinics, and making provision for small children with different conditions that make vaccination not a great experience. So we're very conscious of making these clinics child-friendly for the whole range of small and larger children that we're actually taking care of. But we hope that by the beginning of August we'll have approval. We know the vaccine is here in the country, and so it's just the regulatory approval and then the review by NACI that will be happening, in the very near future. So, just turning now to, the fall. At this point, some minor adjustments that we're going to make to the spring booster campaign. As you know, I've reviewed this, that right now for people 12 and over, we're continuing to give them dose 1 and 2, and it's always interesting. I look at these reports every day to see, well, who's coming in for, a first and second dose or their first booster, and it ranges across all the ages. But we know that if you go down the ages, it's still the 70, the 80-year-olds and above, 60-year-olds. As we go to the older age groups, they are taking up the D3 and the dose 1 and 2, if they haven't already had it, at higher rates. And it's the younger people that we really need to encourage, and particularly to try and get them to come in for that first booster. We want them to come in because they need that protection as we move into the fall. But the groups that we have been vaccinating in the spring booster campaign are the very vulnerable, long-term care, assisted living, seniors 70 and over, our Indigenous peoples 55 and over, clinically extremely vulnerable who are immunosuppressed. And we've had, particularly from people in their late 60s, we get a number of calls every day, letters to Dr. Henry's office saying, I feel that I'm vulnerable. I'm now quite away, 6 months from my last dose, and I'd like to have a spring booster. And so what we're going to do is, allow people who feel they meet that sort of have unique circumstances. If they really want to have a spring booster, we will enable that. But the big message is, the recommendation is really the best thing to do is wait for the fall. That is what NACI has recommended. The reasons Dr. Lavoie has gone over. This is where we're most exposed to respiratory illness. We're moving indoors through the fall and the winter. Our risk is highest, and you want to get your booster when your risk is highest. And the group that were approved for the spring booster were much more vulnerable. So what we will do is allow people, we will be sending an update around to everyone 12 and over and give them an update on NACI guidelines. We'll be doing this through the Get Vaccinated system. And what we will tell people is it's all about the fall. We want you to wait to get your next booster in the fall. If you haven't had your first booster, go get it now. But if for your next booster, it's get it in the fall. But if you really feel that you've got special circumstances, you can give the call center a call and we'll arrange for you to have a booster now. There are disadvantages to that. Dr. Lavoie has talked about the new vaccines that are coming. And, the minimum interval for your fall booster will be 6 months. So if you have a booster early, then the fall, then you will have to wait for your full 6 months to get, access to the new vaccines or to, a fall booster when we're providing it for the whole population. So best to wait and follow the advice of public health, but if you really feel you have special circumstances or you're very worried, we'll enable that. For, the rest of the population, we will be, commencing a campaign, and for us the fall will start at the beginning of September. And, we have to be nimble if things change and take direction from public health, but right now our planning is focused on starting our fall campaign in September. It will be a campaign that will, as always, the priorities will be articulated by our public health leadership. And then our job in the vaccination program is to organize that so that we send out the invitations through the Get Vaccinated system according to those priorities. And we will be doing that as we have for all the other phases of this campaign starting in early September. And for the children 5 to 11, they will continue to get offered dose 1 and dose 2. And if there's a change in the recommendation for a booster from Health Canada in the coming weeks or months, then we will be opening that opportunity up to them at a 6-month interval. And for, as I said, for children 6 months to 4 years, we hope to be opening up their primary series for them, hopefully by early August. So, generally, in summary, NACI has strongly recommended that the fall is the best time to get your next shot. And that's to give us the best protection against respiratory season, the illnesses that move around. It's a time when our healthcare system is always challenged in the winter, traditionally with influenza and other respiratory viruses, and now with COVID in our life, COVID is added to that list. So that's when the risk is highest, and that's the strong recommendation of when we want you to get your fall booster. And, at this point in time, everyone will get invited come the fall. They'll get that invitation, as they have for other things, through the Get Vaccinated system. And, all our campaigns, as the Minister has said, will be done in order of priority. And for those who, as I mentioned, are going to want to get it early, we will be sending out invitations, not invitations, but there are updates will go out to everyone, but they will go in the order, as we always do it, of those who are the oldest at the longest intervals will get their updates first, and those updates go out at about 40,000 a day, and so that will start rolling on Monday. So on Monday we'll be sending an update telling everyone about the NACI guidelines. Get your booster in the fall, but if you feel extremely susceptible at this point in time and you're not in the vulnerable group, then we will enable you to get an early booster through the call center. So finally, Dr. Lavoie has talked about this. Boosters benefit us in many ways. Essentially it provides us longer protection. It stimulates an immune system that's already been set up by your early shots. It protects people who have a higher risk of illness and who have, immune systems where the protection wanes more quickly. And that's mostly our elderly people, or if you have a condition where you're immunosuppressed. And generally, as we've seen, it's kept our communities safe. It's got us back to, near normal. It's not completely normal. And it's allowed, our hospitals to carry on dealing with things that are also very important. And so just a reminder on the golden rules, get all your recommended doses. My 1.3 million that are out there that haven't had their first booster, come on in, we're waiting for you. Follow the health guidelines, stay home if you're sick, wash your hands all the time. Respect people's personal space. We know that outdoors is safer, and that's why the summer is such a great time, and we usually do better in terms of respiratory illness because we're outdoors, enjoying the outdoors. Take into consideration other people's situation, elderly people in your circle of family and friends. And if you're going traveling, check before you travel and make sure that you're up to date on the guidelines and the advice that comes in from the federal government for travelers who are going out around the world. So thank you so much, Minister and Dr. Lavoie. And I'll turn over to you, Minister.
Thank you very much, Dr. Lavoie and Dr. Ballum. I just want to say finally, again, strong and emphatic thank you to everyone in BC who has supported this effort in our province, to all the healthcare workers and healthcare professionals who have on the ground delivered our vaccination program, to Dr. Ballum and her team, her incredible team of both staff and volunteers who supported this program, people who have worked through the past year in the service industry and who came out and made the customer service of our vaccination campaign so outstanding. And I have to say, I have never seen, in terms of our surveys of people who received the vaccines, so much public support for the delivery of those vaccines. I mean, getting a shot, I take a few every day because I have type 1 diabetes, but getting a shot is not a fun thing, but it is an important thing. And people have different reactions in different circumstances. I think our team has done a fantastic job. I want to speak just to the people who have followed our guidance and got the vaccines when they've been asked to get them, when they've been invited. the 2.8 million people who've got their first booster, their third dose, and that 2.8 million people are obviously strong supporters of the vaccination campaign, and we are very appreciative to them. The message to them today, except for those who are 70 and above and those who are in clinically vulnerable 1 and 2 categories who have immune issues, is that a fall booster campaign is coming, and that's the best time to get it. But we also respect you and your judgment. And so we will be contacting you. You've got to wait till we contact you over the next few weeks, as Dr. Ballum said. And if you feel like you need to get a booster now, one will be made available. And I want to say to everyone in that group, thank you. So that 1.3 million people who've got their 2 doses are eligible for their 3rd dose and haven't got it yet, it's time. This is a really good time. As we see circumstances here and around the world, an important time. And as Dr. Ballum says, we're here and ready for you. And thank you for getting the 2 doses. This is a good time to get your first booster dose. And those people who haven't got their first dose yet of a COVID-19 vaccine, it's 6% of the population in BC. It's about 1 in 16 or 1 in 17 people. There is never a better day than today to get vaccinated for the first time. And I want to say that we will welcome you, and every day, it's not because we've been doing this for some time, a large number, but every day some people come in for their first dose, and we want to express our appreciation and our support to all of them. And thank you in advance for getting those doses. We are working hard to ensure that this outstanding vaccination program that serves people in every community in BC, from Indigenous communities and our partnership with the First Nations Health Authority, to communities in every health authority, that we are going to continue. And it's a major challenge in the fall, but we are going to continue to deliver our vaccination program to you, to respect and honor and celebrate everyone in BC, and to do what we've done from the beginning of this pandemic, which is to work together, all of us, to ensure that to reduce the impact of COVID-19 on ourselves, on our neighbors, on our friends, on our communities. It's very important to protect our healthcare system and allow us to do, in the midst of a pandemic, all the things that we hope and dream and aspire to do. So thank you very much, and we'll be happy to take your questions, Dr. Ballum, Dr. Lavoie, and
This show has been produced by Depictions Media. Please contact us at depictions.media for more information.